All right, thanks a lot for joining us. Let's talk health now, and yet another health concern, and that's talking about Lassa fever. Well, statistics according to the Nigeria Center for Disease Control and Prevention, the NCDC, says that no fewer than 227 deaths, as well as 1,270 confirmed cases of Lassa fever disease were recorded. This from 28 states in 2023. And now, this year, the Federal Capital Territory Administration has sounded yet another alarm as Lassa fever makes a reappearance, with 2 confirmed cases reported in Abuja. We have details in this report.
In Nigeria, Lassa fever occurs in certain states during the dry season when rats leave the fields to find food from other sources. This leads the rodents into close proximity with people's homes, allowing contact with humans while seamlessly transmitting the virus through contaminated food and water. So far, 486 suspected cases, 134 confirmed cases, and 21 deaths have been recorded, with a case fatality of 15.7%. Now, the Public Health Department of the Federal Capital Territory Administration is giving an update following a response alert to a death of a confirmed Lassa fever case in Bauchi State.
On the 15th of January, the children were presented at our hospital, and based on a high index of suspicion from the case history and from the fact that their mother had died from a hemorrhagic fever, one of the children was confirmed positive and was immediately moved to the National Hospital receiving care. A 14-month-old baby.
Get diagnosis of what is the problem before treatment. So I would think that you should avail yourself of the services of trained health personnel.
People in the field in the community are able to identify what signs and symptoms of Lassa fever are. And so people now will have basically timely reported relevant health
Experts believe that Nigeria is fast becoming endemic, with hotspot states discovered in Edo, Ondo, and Delta states. Kemi Balogun, TVC News, Abuja.
Joining us now in the studio to discuss more on the impact of the Lassa fever disease is the Executive Director of the Health Emergency Initiative, Pascal Achinine. Thank you for joining us again. It's good to see you with us, see you again.
Thank you for having me.
But what are your thoughts on this? This is a subject that, from time to time we've had a recourse to, come over to you for some insights. But what are your thoughts? We saw how we've seen the losses of people, that recorded in the year 2023, and now yet another warning of, if care isn't taken, that is, this year we might, have more fatalities or even more fatalities. Putting it simply, but then that's a reality. What do you think?
I actually can say that the number is underreported because we are not data-driven, and because Lassa fever comes with mild symptoms. Over 80% of the symptoms typically look like maybe somebody may have Lassa fever and your feeling is malaria. The symptoms like fever, malaise, a headache. At the early stage, when it's presented, it comes with such symptoms, and people may not take it serious. And we also don't have, this is a population that less than 5% have access to health insurance. So people would like to manage it at home, thinking it's the normal sickness. And there's very little education, very little stakeholders engagement, community engagement, to ensure that when you begin to see XYZ symptoms, go to the health facility. So we've not taken intentional steps to address the root cause and preventive measures. Rather, we are seeing the number worsening, the number of fatalities. And I am very more concerned because between last year, when some of this publication happened, and now, there have been more deterioration in many aspects of our health system. We've had many of our health workers traveled out of the country. The facilities have also do not have more resources to run. But I think this requires an emergency fix. I'm glad that there are a lot of initiatives being taken at the most senior level in the health sector, but it must connect with the root cause. And it's also more sad that you see health workers also exposed to these deaths because the typical measures like PPE, protective equipment, are not in place. Most of them, we stopped that practice after COVID stopped. So right now, you may be treating someone, you think you're just managing malaria, regular fever, but you're already exposed to the virus.
You talked about addressing the root cause. How do we do that?
And it requires a multifaceted approach from the policy angle, from resource allocation, to engage stakeholders engagement. First of all, let me take it to the doorsteps of everybody who is listening or viewing. The key thing to know that you must take steps to keep yourself alive. So we do not have good hygiene and sanitation. So all over the place, the primary cause of this disease, the virus, comes from rodents, rats. Let's use the common word. And if you go to the cities, urban areas, countryside, you see rats all over the place. And some of them is not because people like to live with rats, so people do not dispose their refuse properly, so people do not store their food in such ways that when the feces or urine from these rats makes contact with the food or the items that at home, you will not easily be exposed to the infection. So the primary cause is that we have not taken personal hygiene serious as a country, but also people are contending with miseries and pains. Many people can't afford a good accommodation. So you see people, as much as 10 people staying in one room. So all those things nobody pays attention to hygiene. And again, when we get to a stage when vaccine comes, there's no vaccine currently for Lassa fever. We also must anticipate that, this thing happens between December and April every year. That's when the transmission is.
So we're well within the window.
Yeah, absolutely. So there must be engagement. The way you have polio, community health workers going to sensitize in different areas. We have about 28 states currently exposed to this infection, as it were. So there must be intentionality from the ministry to the primary health care system to NCDC to build the kind of momentum they had when COVID happened. If we deploy 30% of such, we will see reduction in the number. You can see the trend. In 2022, the number of reported fatalities, reported in quote, was 189. It moved to 227. And most of the times, that represents the 25% of actual number, because most people do not report, people do not know what to do. They just, we've lost him, we'll move on.
Okay.
Right. But, okay, so you are on all fours with, other medical experts who have spoken about this late presentation that appears to be one of the biggest challenges in combating this disease, especially as you have also, pointed out, the factors or the symptoms actually are, very basic, so to speak, regular malaria, symptoms, but not knowing that it could be something much more serious as Lassa fever. I wonder what you advocate for, because poverty is an issue, obviously. Day in, day out, we're talking about the high cost, increasing cost of, medicines and all of that, preventing people from seeking medical care. What do you advocate for? Because you have said that this should be treated as an emergency head-on.
Yes, so the symptoms most times are very clear within 1 to 3 weeks. I also want to mention, so that people don't underrate that it's just malaria and fever. So when you are taken to a health facility, the very complicated, it comes with some complications, and the 20% of all persons who are exposed to this die when they are those that have the complications. It can lead to abortion in a woman in her third trimester. It can lead to deafness. Out of 100 people treated for Lassa fever, close to 10% of them eventually become deaf. It can lead to swelling on the face. It could also, some of the symptoms is that you'll be bleeding from the nose, eyes, and gums, and other places, and also respiratory complications. This is to highlight that it comes with very serious for the critical cases. And 1% of all infections, like we report, there are about 9,900 are detected. 1% most times die at the end of the day. So coming back to what we need to do is that at this stage we need to deploy more community health workers, and also they protect the health personnel, because one of the key reasons people may not even give their whole heart to managing a case like that is if they are unprotected. So you isolate, number one. So in health facilities, if there are signs... You can't
even be in general wards.
No, you're not, because the fluid can get someone else infected. So you isolate, you provide PPE for those who are already, who are managing those cases, the health workers. But also, there should be further deployment of funds, because the drugs that we are probably purchased at X amount last year, most of them have gone by 3 times if they are available. You know, some of the issues with the pharmaceutical space, some are living in the country. So government must deploy resources, more resources here. And I also want to emphasize that it's a broad-based approach. When COVID came, our organization, Health Emergency Initiative, we provided, some organizations came to us, provided PPE that reached over 10,000 health workers in Lagos. So we must activate some of those templates that worked during COVID, that we had a very limited fatality as a country.
Like the lockdown?
No. Lockdown.
Because no, you mentioned isolation, and you know that once it comes, when you're isolating somebody, you have to trace the different people he has been with, in order to curb this issue of Lassa fever, because that was part of the protocol that was employed for COVID as well.
Right. Okay, isolating the people that may have had contact.
But the mild cases,
the index cases.
Yes, if you place it side by side, it is when it gets to complicated stage. But the mild case, it does not translate that if you had contact with someone at that early stage, if it's detected early, presented early, and treated early, it does not make room for a lockdown at all.
But we have situations where people even go to the hospital on time.
Yes, but by the time it gets complicated, the symptoms will be very obvious: bleeding, vomiting frequently, and all that. So those ones are more critical cases that should require isolation.
Tracing. I think the point is,
the issue
of contact tracing.
Yeah, absolutely.
But do you still stand by what you said, moments ago, where you said at the initial stage there may not be need for contact tracing? People who have had contact with the index case.
That's
for example,
a mild case.
Because in mild cases, because I know in the Abuja example now, in the reports we just saw, the official there was speaking about the deceased mother and how that had 2 children, one of them an 18-month-old baby or so is now infected. So doesn't that, extend, don't you see a need to extend, the contact?
It's absolutely very important to overplan. Make extra room in the event that, so isolation for and the contact tracing comes handy to minimize deaths. And one of the things we also do is, as a nation, so if we lost almost 227 last year, as officially reported, what are we putting? And this started since 1969. Lassa fever, that was the first time it was observed here. what measures are we now going to put in place to ensure that next year we don't come and start lamenting over this again? Is it that we would have seen the population of rats? And this goes to neighborhood, community development associations, house owners, residents, tenants, to work collectively to ensure that we can minimize the capacity of these rodents to inflict pain on people and misery. So that everybody has a role to play, but government must lead from the front. And the corporate, the corporate world.
Getting to that,
yes,
the private sector.
We will not just throw our hands in the air that COVID is over. No, this is also a potential area. It could be someone's personnel. But all of us have responsibility for the good of this society. Don't just keep your... So you can collaborate with NCDC. You can collaborate with credible organizations that have track record. Our organization have worked with many corporate organizations over the years in some areas that the government bureaucracy may delay response rate will come in there.
Tell us a bit more about what the private sector can do. You also form part of the private sector. And I like the fact where you said, there were crucial roles that, agencies, organizations like yourself played during the COVID.
Yes.
During COVID, especially looking at, government was working hard, to combat the spread, and then they had support from the private sector. But specifically in this regard, would it also be, more of provision of PPEs, or are there other direct ways that...
It goes beyond PPEs,
absolutely.
because the drugs are expensive, and that can be... Private sector intervention can augment what the government is doing. The private sector can also identify organizations that are close to the people, so people don't easily trust. We know that when communications come from the government, when there's an amplification, a support or a voice that is not government, it also gets to the people with more, relate to it with more trust. So organizations like us, it may be in the area of community engagement. What do we do to reduce the population of the rodents? How do we enhance hygiene and other measures that ensure that the primary source of transmission is kept at bay? Those are potential areas. And then advocacy and sensitization, including the media, should also put more effort in bringing it to the front burner.
Right. Before Theophilus comes in, quickly now, on the issue of rodent control, I wonder how you preach that gospel when you go out and, speak to people. This is, basically about hygiene. How easy is it now to correct mindsets of people, making them realize that this is not just about living cleanliness, but this is an issue of life and death?
So we realize that we have had some engagements with community development associations, landlords, residents, and when they see that there's also an insecticide sort of that is used in dealing with the rodents. So that's a potential area. Distribution of it can also help in minimizing it. But there must be sessions, town hall sessions, engagements, deploying community health workers to those locations. This is the implication of if you continue to maintain this lifestyle or this hygiene, if you don't improve on it. Those are critical things that must be done. And then waste disposal is also a critical area that LOMA and other agencies that are saddled with it, because that's where the rats, that's their natural habitat. That's where they live. So the waste disposal must also practice, and there must be improvement both at the household level and on the part of the government. And then finally, I think it's very important to look at, having known the root cause, this is just a few that we have mentioned. So we can take a deeper look at RTA, root cause analysis. So what would you do to ensure that this number reduces by 50% in 2025? Right. Those are critical things that we throw to the policy makers, decision makers, and of course all of us working together.
You talked about deploying of funds now and deploying of personnel, but we're in situations where the government always say there's no fund, there's no fund. Who should fund this? Because this actually is domiciled in local governments where these health workers will go to sensitize, and also if there was vaccine available to apply vaccine, and to also treat those who have come down with Lassa Fever, maybe the mild cases. But the problem that the government will always say is lack of funds. How do we address that?
It's about, do you place value on human life as a government, as a corporate citizen, as a philanthropist? If you place value on human life, and it can also come as epidemic, a particular virus that's taking away the lives of, including medical health professionals. You cannot say there is no fund. And I think if also there's a genuine transparency in when resources are committed in your hands, either as government or as a body, NCDC, etc., if people seek higher level of transparency, corporates will put more resources there. But this is not something we have a choice whether we should. We have funds or we don't have funds. I am aware that, and all of us are aware, if the government wants to carry out anything and get results, government goes and get funds. If the private sector is interested in an area, let's look at the reality TV space, where most of the corporate organizations deploy their money CSR. So a portion of that can also come into addressing this. If we are, and then the philanthropists are also there. Individual philanthropists that, oh, you're looking for credible organizations to work with. There are some of us that have also been there for 8-10 years with track record. Let me give you this as I end. When we got involved, we were given a PPE worth 45 million, our organization, by one of the corporate organizations.
This was during COVID?
During COVID. And we did not write or reach out to them. They went to government hospitals here and asking, made inquiry, which organization is credible that you want to recommend to handle this. For Lagos, we did the whole of Lagos. They say Health Emergency Initiative. And 2 years after, they gave us more of that to handle on their behalf.
But you've also spoken about some of the peculiarities in our system in Nigeria, and that is the shortfall of medical personnel. This against the recommendation of UN of one doctor to is it 10,000 patients, but of course we are having far more than that with the syndrome now, the Japa syndrome. Many personnel have left Nigeria seeking greener pastures. So what are your thoughts on this? How can we work around this? Because that is a reality in Nigeria, and we're having one of the many emergencies, so to speak, or concerns in the country.
So when a war breaks out in a country, they call for reserve. They call in the reserve. So we have enough reserve of persons here who are either retired or those who are out of employment that are looking for opportunity to serve. If a government sets up a credible system that they want to mobilize manpower to get this done, it will be achieved. It's that transparent will to get it done.
And our people are retired, personnel.
From retired to those who have actually been trained locally here, but they don't yet have employment in the formal sector. They are available. We have also, my organization trained people on CPR and first aid, etc. We've done that for some community health workers. We have a good, knowledgeable number of them, but they just want to be empowered.
They're just waiting.
And
They're
given
just
opportunity to
basically waiting.
solve this. So we can. And it requires cross-sectoral collaboration.
All right, so cross-sectoral mobilization and, of course, involving the private sector, government at all levels and all of that. But for us as a people, how do we address the issue of dirt around? You mentioned that earlier, and the fact that we see, in the past we used to have things like, let me use the local parlance, kule kule.
Okay.
But now we don't have that.
We also have inspectors. We also have people who go around.
Yeah, but now we don't have that. We have periods where we have sanitizations once a month. We don't have that anymore. What can we do as a people to adequately and properly dispose of our dirt?
The medium and long-term journey is okay. Local government functionally coming into this space. State government overseeing or oversight on that. But more critical is we have CDAs. That's the most effective way to approach this. Landlords be mandated, house owners be mandated, residents be mandated that this is the waste management system we will have to employ or maintain. This is the hygiene system, and have a way of tracking it. We also have Minister of Environment. So Minister of Environment has a critical role to ensure that we achieve a lot of mileage in this space.
But that's the problem now, because it might be monitored once or twice or maybe in a week. And after which...
Sustainability.
Yeah.
That's why I said community engagement is critical.
Right. All right. That will be a fine place to leave it there. Pascal Achunine, Executive Director, Health Emergency Initiative. Thanks a lot for your contributions.
Ashoka fellow, yeah. He's a fellow of Ashoka. Yeah.
All right. But we thank you very much for, these contributions that you have made. And we hope that, the right persons are listening. And so we can, work out a way to curb down the cases of Lassa fever. Thank you again, Pascal Achunine.
Thank you for having me.
Thank you for coming.
Have a wonderful day.
Thank you, and you too.